Hello everyone, my name is Gusheen and you're watching Nation Next. Today we're in conversation with Inspector General of Police Vijay Sakhare, who is the first officer in rank of IG to become a city police commissioner. Mr. Sakhare was serving as the Kochi Range IG before the appointment. He is in news because of successfully containing COVID-19 in Kasaragod in Kerala. Welcome to the conversation, sir.
Thank you, ma'am.
You're welcome. Sir, to begin with my questions, in India, the first positive patient of COVID-19 was detected in Kerala. Back then, what decisions or what improvisations did you, as a police officer or the state, do to prevent the outbreak to not spread and not spread in public?
Yeah, that's a very long and detailed initiative, ma'am. But anyhow, Kerala
Right.
model now is being hailed as a model which entire India should follow. So many things were done by the state of Kerala. But when we talk about all this initiative to control or contain COVID, there are
Right,
two
sir.
main frontline services who have basically done the most important thing for the containment. One is obviously the health officials, doctors, nurses, sanitation
Mm,
workers, and second is the police department. The doctors have
right.
treated, whereas police department has tried to control the spread of the COVID. So this is how, and rest of the other departments have basically facilitated these two departments for the overall containment of the COVID. So in
Right, sir.
Kerala, obviously, the first case was reported long back, 2nd of January.
Yes,
And
sir.
later on, as lot of Malayalis work abroad, when they came back with them, a lot of people became positive. So government of Kerala started acting very early
Right,
as
sir.
February, and the checking of passengers at the airport started. And
Right, sir.
checking was basically three-way checking: the thermal imaging, the symptomatic checking, and the verbal questioning. Based
Mm,
on that, these patients were divided into three categories: A, B, and C. A are those who are basically low category. B are
right.
mild, and C were the high category people. So B and C, they were immediately moved to the hospitals, whereas
Right.
A were asked to go undergo home quarantine. That is how government of Kerala started. And later on, what
So,
happened was the biggest challenge was this: A and B patients, they were not observing the home quarantine. So that is why
mm,
increasingly many of these people became positive. And
mm,
in Kasaragod, especially, number of cases increased very suddenly. So because of that, on 20th of March, government of Kerala decided to implement lockdown of the
right.
district.
Right.
And that is how my involvement begins. I am basically Commissioner of Police Cochin,
Right,
and
sir.
on 23rd of March, the Kasaragod district saw reporting of 19 positive COVID cases, which was a
Right.
matter of great concern. So
Mm,
immediately, the Honorable Chief Minister decided that
mm,
I should be moved as Special Officer COVID to
mm,
Kasaragod for ensuring that lockdown is complete, because the
mm,
local administration and police was not able to enforce lockdown. And secondly, by doing so, I should be able to stop the spread of COVID. So that
mm,
was the twin objective of putting me here. So I came here on 24th morning, and
mm.
that is how this whatever we did after that, it was basically thinking on the feet, strategizing for containing the spread of virus, and which
Mm.
now has become a Kasaragod initiative.
Right, sir.
Yeah. So
So
taking,
Kerala is,
yeah,
yes, sir,
yeah,
sorry.
please.
Kerala is often seen taking a different route from the rest of India. While some states followed the lead of Honorable Prime Minister, as even you mentioned, you started a lockdown way ahead than the lockdown was implemented all across the states. So, how has that lockdown helped Kerala improve, or how has that helped people or to the police personnel or the state government to improve and take better decisions for the citizens?
See, we know that, ma'am, we know that there is no treatment for COVID,
Hmm.
and it spreads by contact. That is why we have to
Yes,
maintain social distancing. And world
yes,
over, we have seen that the infection has spread very fast. We have the examples
yes,
of
sir.
China, Europe, as
Yes, sir.
well as US. When it was reported in Kerala and the numbers started increasing fast, and we know that it basically grows exponentially. So there was every
Mm-hmm.
chance that it would have grown very very fast in Kasaragod. There was a time
Yes, sir.
when almost 50% of the cases of Kerala were reported from Kasaragod. So
Right.
lockdown is the only way through which we can enforce social distancing and thereby delay the spread of virus, because it takes at least 14 days for virus to uh,
Yes, sir.
yeah, to for a person to get cured. So
Yes, sir.
if 14 days a infected person does not transmit this to other person, then we would be able to break the chain and stop the spread of virus. So that is why government of Kerala decided to act fast and they brought in lockdown, and I was moved to
Mm.
Kasaragod. And then I will
Mm.
explain what we did, which basically would be matter of more interest to you and your viewers. So
Yes,
what
sir.
we did,
Yes, sir.
which has now become a very, very popular and successful example in entire country, is called as Kasaragod Initiative of Kasaragod Police. So it
Right,
what
sir.
I am going to talk about is basically a containment strategy, and this is a strategy of police department. So basically, this strategy is strategy of containment, and
Mm.
broadly we call it as a strategy of three locks: lock one, lock two, and lock three. And in addition to these three locks, we have used technology in a very innovative manner, as well
Mm.
as we have leveraged the community policing in a big way. Lock one,
Right, sir.
when we talk about, is on 24th morning when we came. I spoke to my officers and we devised a
Mm.
strategy, briefed everyone, briefed the policemen as to when they are going to go in the field. They are exposed
Mm.
to the infection in the biggest way. So
Yes, sir.
we distributed personal protective equipment like mask, gloves, and sanitizers, and told them
Mm.
how we have to implement lockdown. So
Mm.
as part of lockdown, lock one, which is done in all rest of the country, we adopted the erection of roadblocks and use
Mm.
of mobile patrol. What we saw
Right.
on 25th is the life was going on as usual in Kasaragod as if nothing has happened. Lockdown
Mm.
had no effect. So what we did was we stopped all everybody, and 80% of the people were returned back who had no essential service or essential things to buy.
Mm.
So with that, the crowd was brought under control. Then we said that anybody who has come out for no valid reason, or that is
Mm.
essential service of purchasing essential goods, we seized
Mm.
their vehicles, we arrested people, lodged a lot of FIRs. So very stringent
Mm.
criminal action was taken.
Right.
Then we enforced very strictly the no double riding of motorcycles, only two
Mm.
persons in the car. Then we staggered the timings of the people who were coming to town. We cut off the
Mm.
villages from one village to other, so that
Mm.
whatever a person has to do, he should remain confined to a village. So
Mm.
all these things, by 26th evening, we have been able to contain we were able to bring down lockdown very very successfully. So
Mm.
only those people who needed essential items or who were delivering essential services were coming out by 27th morning. So that was the phase one. At the same time, I will talk about other initiative, technological and community policing after I cover the three locks. On
Yes, sir.
27th, what we did was from 24th onward, we were collecting data about the
Mm.
people who have become positive.
Right.
Then primary and secondary contacts of these people who became positive.
Mm.
So, and we mapped that data on a geographical information system, GIS. a very interesting picture emerged when we saw the GIS. We found that all these positive cases and their contacts were concentrated geographically in seven distinct areas
Okay.
or clusters. So what we did, we
Right.
cordoned off these areas and isolated them from the rest of the district. So
Okay.
that is how these seven areas became containment zones. And within the containment zones, there were shops. So people were using those shops for buying their things, but nobody was allowed to come out of the containment zone. Only one entry and exit was allowed. That too for basically health officials, or if there is an
Right.
emergency. Then we use
Okay.
drones for enforcing lockdown in the containment areas. So
Right.
with that, basically the our formulation was this, that if a positive patient is has stayed in a containment zone, there is high
Mm-hmm.
probability that he might have come in contact with others in areas surrounding his own residence. Normally, which is, we can safely presume around 500 meters to 700 meters.
Mm-hmm. Right.
It's a radius of around 2 kilometers. So once this area was cut off, the chances of infection spreading out of containment zone were very, very less. That was lock two.
Mm-hmm.
Then,
Right.
then another strategy, lock three, we introduced later on, because
Yes,
the
sir.
last flight in Kerala came on 22nd. In India, came
Yes,
on
sir.
22nd. So all those people who turned positive, basically they would have turned by within 14 days from 22nd. That comes to the 4th of April. So after 4th of
Right, sir.
April, the possibility of Indians who have come from abroad positive was very less. So what we
Right,
did,
sir.
these people were staying in their homes, they met their friends and relatives, and nobody was
Mm-hmm.
following home quarantine. So we started focusing on their primary and secondary contacts because they
Mm-hmm.
had highest probability of becoming positive.
Right.
And the third lock is basically meant for keeping this primary and secondary contacts confined to their homes. And it
Right.
consists of putting a police guard in front of their homes so that they
Mm.
do not come out of their homes and mix in the society. Secondly,
Right,
we
sir.
created beats, mobile motorcycle beats covering 10 to 12 such houses. And these constables, whenever they visit a particular home, they had a list of
Mm.
all the inmates who were staying in that particular home. They used to call
Mm.
all of them out and used to
Mm.
check whether everybody is there or not. If somebody is found missing
Right.
or somebody is found violating the quarantine, he was shifted to government quarantine. Third thing we did
Okay.
was we created a drone beat. The drones were routed in a manner so that they cover these houses. If anybody, when guard
Okay.
or policeman is not there or mobile patrol is not there, if he or she tries to violate the quarantine, then
Mm.
they he or she was shifted to the government quarantine. Then fourth thing we
Okay.
did was we installed a COVID safety app in their phone.
Mm.
What this
Mm.
app does it, if a person moves beyond 50 meters from his location, then we
Mm.
get an alert. And such people,
Okay.
first time they were warned, and second time we moved them to the government quarantine. So by doing
Okay.
putting this third lock, we have ensured that each and every primary or secondary contact remains confined to home. If they
Mm.
remain confined to home, then the infection will not spread. So that is what the theory of
Absolutely.
lock is. Lock one is for the
Absolutely.
entire district. Lock two is for the population residing in a containment zone. And lock three is specifically for those people who have the greatest potential of becoming positive because they have come in contact with the positive persons. So this was
Right.
basically strategy of containment. But along with this, we have done several things. For example, we have brought in technology. One of
Mm.
the most important things or important challenges for us was to keep the persons who are in home quarantine in their homes. For example,
Mm.
when I joined, Kasaragod had close more than 10,000 home quarantine people, more than
Okay.
4,000 Indians who have returned from foreign countries, and
Okay.
around 6,000 primary and secondary contacts. So
Hmm.
keeping them, and none of them was willing to
Hmm.
stay at home. They were not observing home quarantine. So immediately on 25th, I had developed an app by name Safe COVID Safety App. So
Okay.
we created a team led by sub inspector
Hmm.
and several teams. To be precise, 100 teams were made all over the district. This team used to visit each and every home quarantined house. 20,000 to be precise, we had. So this team
Hmm.
visited these houses several times. They used to go and they used to tell people, you should not come out because you
Hmm.
have the highest probability of becoming positive and
Hmm.
you should follow your home quarantine. And
Right.
then we used to share videos of WHO,
Hmm.
uh, which used to demonstrate how to maintain home quarantine. One,
Hmm.
what are the precautions one should take to protect oneself against the COVID and things like that. All these
Hmm.
videos were done, voiceover was done in Malayalam so that they could
Okay.
understand. Thirdly,
Hmm.
on the same day, we had launched another app by name Swaraksha Kasaragod. Swaraksha
Okay.
Kasaragod is a telemedicine platform. For example, all these home quarantine people, they are not positive, but they have
Right.
probability of becoming positive. When there is
Hmm.
lockdown, people become restless. They
Yes.
feel that they have become COVID positive. They want to talk to doctors, but
Hmm.
doctors are a most precious commodity during such times. So
Right.
you can't go out also. So
Yes.
we created this platform in which we told them if you send a WhatsApp message on this particular number, which is
Hmm.
Swaraksha Kasaragod number, our control
Okay.
room, COVID control room police control room will call you back and
Right.
it will connect you to a doctor. So we have
Hmm.
connected more than 20,000 people with the doctors. And
Okay.
secondly, if they required any medical help, or if there's an emergency, they require medicine, they require ambulance service for going to the hospital for COVID or non-COVID related emergency. Then police ensured that ambulances reach their medicines reach to these people on time. So idea was to tell them you are in a lockdown situation, you are home quarantine, but you are not alone. We are with you.
Hmm.
Kasaragod police is with you. Then we told them for this app would be extremely useful for them, but
Right.
they should not leave their house.
Hmm.
And if they want to access these services in case of emergency, we require
Hmm.
their location. So they all
Hmm.
of them agreed for sharing this location. This
Right.
location we got it using our COVID safety app. And we told them if
Okay.
you change your location by 50 meters, we will get to know and we will shift you
Right.
from home quarantine to government quarantine. And we have
Right.
shifted. There
Right.
are close to 4,000 violations, and we have shifted more than 300 people to government quarantine. Then legal action was taken. More than 1,000 cases were taken. That is what
Right.
we did at the start itself. Then
Right.
that was one. I have told you about COVID safety app. I have told you about Kasaragod Swaraksha.
Yes.
Another thing we started was we realized when we created these containment zones, those
Hmm.
people who are staying in containment zone that was started on 28th,
Hmm.
they were not allowed to go outside a particular geographical area. It was cordoned off. If they required certain things, it was not
Right.
possible for them to get them. Not only that,
Right.
we have brought in severe restrictions for movement of people inside the containment zone also. So
Right.
in such a situation, they would be put to great hardship and inconvenience if they are not able to get the essentials. We said,
Right.
don't worry, we have created a WhatsApp platform by name
Right.
Amritam. You can see
Right.
on the Facebook or if you
Right,
Google,
sir.
you know, and you simply have to send a message to us
Hmm.
that these are my requirements, whatever
Hmm.
vegetables or oil or whatever you
Groceries.
want, or
Right.
medicine,
Hmm.
and we will deliver it to you by evening 4 o'clock. So this is how we promoted it. That it is faster than Amazon. We deliver you things within 4 hours, and it became instantly popular. People started sending their requirements on this app, and we
Hmm.
supplied all everything to them. So that we started on 28th, and by 30th we extended this entire home delivery service for entire district. So now the idea was nobody should come out of their homes.
Out of their
If they
houses. Yeah.
require essential items, police will supply them, and that
Yeah.
proved to be extremely useful in keeping people home. So likewise, this particular app, home delivery app, helped us in keeping people in. Another thing we did was the most important thing in containing the virus is that we should know who are the people are who have the potential of transmitting infection. That is primary
Hmm.
and secondary contact. Unfortunately, what happens is doctors are too busy in treating the patients. The health
Hmm.
inspectors, they normally carry out these inquiries. They do
Hmm.
not have requisite experience and expertise in tracing all the contacts. What we did
Yes.
was we told them, okay, you carry out initial inquiry for a day. Then we created 30 different teams headed by officer of the rank of sub inspector, and we asked them to take over these inquiries. With
Hmm.
our experience of investigation, we were able to find out almost every person with whom a positive person has come in contact. So list of
Right.
primary and secondary contacts we increased by 50%. And by
Right.
doing so, we were able to identify each and every person who had all the potential of transmitting this infection to others, which was a very important intervention. And then we focused on them, we kept them at their homes. So likewise, using the locks, lock 1, lock 2, lock 3, the
Yes, sir.
different technologies and community policing, in the sense our teams visited all these 20,000 people over a period of 1 month, in last
Right.
1 month, several times. And we have taken action, moved people from home quarantine to government quarantine, taken registered criminal cases. The overall effect of all this was we have been able to focus and keep those people who could have transmitted infection to others in their home, and thereby the results are very clear. When I joined here
Right, sir.
on 24th, the number of cases in the district were 36. Within a
Right, sir.
week, by 31st of March, the cases rose to 106, which was a whopping increase of
Increase.
4 cases. By 7th of March, the cases became 155, and increase of 47. And we started our initiative on 25th. So our 15 days got over on 7th. From
Right.
8th, next week ended on 14th, we could add
Hmm.
only 11 new cases. Today is
Okay.
17. So
Yes, sir.
if we start from 8th to 17 is basically 10 days. In
10
last
days.
10 days, we have added only 13 cases.
Wow.
So this is what I said. The containment strategy proved to be extremely successful in reducing the reporting of new COVID cases. At the same time, wonderful thing has happened. In last 1 week's time, we have been able to discharge 113 patients who were in hospital.
Right.
As on date,
So
yeah,
I
please.
must take the liberty to say, if all the states implement the same rules as Kerala has done, I feel not just Kasaragod, every state, every district in India will be COVID-19 free really soon. Because with the kind of strictness and with the use of technology and with the use of manpower, the kind of implementations which have been done, I must applaud you for that, for the brains behind it and for the effort behind it, because I am sure it's not an easy job. As much as it's not an easy job, it's not acceptable for people. You can't really force them to stay inside their homes, because even if you ask a little child not to touch that, the child will go and definitely touch that. So um so how was it to like win people's fear, win people's trust over their fears? during this time, especially where they have to trust you and make sure that you're taking a right decision for them to by letting them and by forcing them to stay at home.
That's a very interesting question. Actually, what we did was, see, there is, in such kind of crisis, because see, as a police officer, I have also never dealt with pandemic. Controlling
Yes.
infection by using the professional policing method is something which is unimaginable. But what we did was, infection is transmitted only by the people, and we
Right.
as police officers know how to control crowd, how to control movement of the people. So what we
Right,
did
sir.
was, we established a very good communication channel with the people. For example, I came here on 24th, and on the evening itself, after making strategy, I went to media, and I, with the local channels and newspapers, I communicated what I am going to do, how I am
Mhm.
going to bring in lockdown, and it is going to be a ruthless thing. Reason
Yes,
being,
sir.
I told them, we are not fighting against people. People are not our enemies. They are
Right.
our friends. We are here to protect them. Our enemy is virus. Our fight is
Yes.
against virus. And for
Yes.
fighting virus, this is what we have to do. We have to stay
Hmm.
away from each other. We have to stay at our homes, and that is what I am going to do. And we did that. And that ruthless implementation of lockdown and our focus strategy of starting from the general lockdown and moving towards the confinement of the infection to the home has worked,
Right,
and
sir.
obviously technology helped us. Second
Hmm.
thing which I would like to mention is, this is not my job alone. Actually, I have been brought here as a special officer, and I am only the leader. I have been assisted by very able officers, my own probationer and junior Ashok Yadav, who is IGP North Zone. He was with me, who is hit with me. Then I am being assisted by two IPS officers at the rank of SP and another
Right.
SP from the SPS. So all of us, an
Right.
entire police force of Kasaragod, all of them have worked very hard. It's very hot
Yes, sir.
here. Sun is
Definitely,
very,
sir.
very hard, and all of us are working right in the minefield, because anybody can be infected and you have to deal with them. So all brave police personnel have worked very hard, and they have worked with a great sincerity and commitment, and they
Yes,
work
sir.
in a strategy, and that strategy we have been able to implement and enforce. Because of that, I can say, after 3 weeks of our implementation of strategy, I can foresee next week, for example, last 6 days, I have just tweeted, last 6 days,
Yes.
our score line of positive cases looks like a great bowling over by Bumrah. It is 0-0-1, 0-1-0. So only two
Okay.
cases in last 6 days. So
Right.
this was made possible only because of mm, the strict implementation of our strategy, which was not about not allowing people to come out from their homes only, but targeting those who had the potential of transmitting infection to others.
Right. So, during a crisis or taking, for example, a pandemic like this, elders of the nation, or for example, rural districts are said to suffer the most. Elders because they have less of movement and are less advanced in terms of technology in comparison to the younger adults, and rural areas because um, they I have seen some WhatsApp forwards and some videos of over social media where they exactly don't know what the virus is all about. They just know we have to wear masks and use sanitizers, but what the human transmission is going to do, how the social distancing needs to be maintained, that they're not well informed about. So how did Kasaragod police um, make sure that the adults are well informed about the technology, or the rural areas are well informed, and they are taking appropriate measures and precautions for themselves and trying to ease Kasargod police's work?
Ma'am, actually, Kerala is has a very well developed community policing program. It is called as Jan Maitri program. So as part
Right.
of the Janmatri program, it is already 10 years for the program, and it has earned a lot of accolades not only in India but internationally also. So as part of Janmatri program, we have already prepared lists of senior citizens living in the district, their phone numbers,
Right.
and the Janmatri beat constables, they keep on visiting them regularly, like the bobbies in the London.
Yes.
Similarly, we have a list of those people who are living alone, then
Right.
the specially able people. So what
Hmm.
we did when we started on 24th, we put a team on contacting all these people over phone and
Right.
asking them whether they
Right.
are safe, what is their requirement, what needs to be done, what precautions to be taken for protecting yourselves from the COVID. And
Correct.
our Janmatri beat, they visited all the senior citizens and specially abled people and
Hmm.
reassured them. And most of them, what they require medicines, they
Yes.
require certain essential items. So all of them were brought by us to their place. Even before our home delivery system, Amritam, came into force, we started supplying essentials and medicines to them. So their needs were also taken care of. And as I said, our Swaraksha Kasaragod platform, we have given them this particular WhatsApp number and told them how to use them. So all of them were using this particular platform. So what we did,
Right.
what we ensured was, though the lockout has ensured that people maintain social distancing and they are confined to their homes, but we ensured that they do not feel that they are alone. We
Hmm.
are with them all the time, and all their
Absolutely.
needs we would fulfill, including
Hmm.
senior citizens as well as the specially able people.
Right. So we've seen in many countries, mostly talking about US and UK, that there was a lot of panic buying before the laws were implemented for their betterment. People would go in groups and buy a lot of needed and not needed stuff for their houses, as if that would be the last day of they would get their stuff. Usually just panic buying in India as well, before laws were implemented, everybody would, storm on the ration stores in the supermarkets to buy all the needful. Did Kerala witness the same before your implementation of laws?
Not exactly. See the in Kasaragod anyhow, it was implemented much ahead on 20th itself. Real enforcement started from 25th onward. But overall in Kerala, on day one, yes, there was long queues. People bought, but later on, the government of Kerala and government of India has also said that the guidelines are very clear. Clear. You
Mm,
can come out for buying your essential items every day between 11 to 5. So in
right,
Kasaragod, what we said is you come out, buy your groceries for entire week. And those
right,
people who are coming, we staggered their timings also. So because of that,
right,
and plus we had a home delivery system. So because of that, there was no need for anybody to buy in panic. We said, and not only that, Government of India has ensured that the essential as well as non-essential movement of vehicles, lorries,
mm, yes,
was allowed, permitted. So,
yes,
though the movement had reduced, but supply chain was maintained. So, I have not seen any kind of shortage of any item in the market,
right,
or nobody has told us that there is a shortage. We have Civil Supplies Department, Supply Co. They have done very well. All the private merchants association, they have been working very well. So, rather, it is a reverse situation. Merchants
right,
Association, they have come forward and they say that, sir, we have been asked to keep our shops open, but nobody comes.
okay,
So, and
mm,
we are spending lot of money on our overheads. So, can we?
right,
So we said, obviously, you can. When the crowds have dwindled, why should we open entire all the shops? Only 20% of the shops would suffice, and anyhow, we are
true,
delivering things at home. So, as
mm,
such, initially there was some panic buying, but the panic did not set in because and people got all the supplies.
Right. So as you mentioned that some of your officers would go to people's houses and, look after them or take their reports or, do all the necessary stuff, even if they're elderly or even if they're home quarantine. And few of them were in a team where the technology, like the drones and everything was looked after. So, how did you manage or how did the people juggle in between the two? Because at the same time you're delivering, at the same time few people are managing with the technology and with the development of the app and everything. So how did the police juggle in between the two?
Nothing, ma'am. You have to plan your activity. For winning the war, it is very important for you to have strategy. Number
Right.
one, you should have a strategy, and number two, you should distribute your operations among your people based on their competence and based on their interests. So we had different teams for doing all these things. So
Right.
people were there everywhere. Lock one, lock two,
Yeah.
lock three, our apps, the people visiting quarantine homes, our tracking teams. So everything was working separately. People were using drones, people were doing mobile patrolling, people were doing the taking the calls, supplying things. For everything, there were different teams. So
Right.
what you plan? You should plan and you should deploy your resources in a particular manner so that you get optimum result is what is important. And police is a manpower intensive department. If you
Yes,
do not
sir.
manage your resource well, you will end up wasting lot of resources and you will feel that you require more manpower. For example, I have close to 1,000 people with me, and
Hmm.
which is very less for a district. For example, in
Right.
Kochi Police Commissioner, I I have close to 4,500 men under my command. But
Wow.
we did not ask anything from outside. We managed all our local resources and we implemented our strategy. And absolutely, the teamwork of all the officers and hard work and commitment of my police personnel, we are seeing the result. Rather, we are the only district in India who
Hmm.
have turned the COVID around. And as
Yes.
you rightly said, I would be happy if anybody, lot of people have called me, lot of police officers from across India have called me, Pune Commissioner and Commissioner of Police from Noida. These people called up and they were asking, can you share what is your model? I said, my model is very simple. This is my model. And we have shared. I have shared my COVID safety app with others, my initiative with others. So if everybody takes advantage of this and if we can contain COVID, I'll be the happiest person.
Hmm. So precisely that would have been my next question. That now that Kerala is doing so good, especially your district, it's going to reports suggest that it's going to be COVID-19 free really soon if the people follow it with the same strictness and the same laws are implemented for a longer period of time. It might also be COVID-19 free really soon. So if hypothetically you were to lead Maharashtra, where the number of positive, highest number of positive cases are there in the country, what things or what rules or regulations would you implement in this state so that it's not only a blessing in Kasaragod, Kerala, but it's also becomes a blessing to Maharashtrians.
Ma'am, what I would say is that the question is hypothetical, but answer is very much in front of us. The
Yeah.
strategy is about the containment, and whatever I have discussed with you over last half an hour is the strategy.
Yes.
Numbers in Mumbai or in Maharashtra are more because I
Hmm.
think there was some delay in bringing in these containment measures because containment zones are there also. They are also
Yes.
trying to trace the contact, but the aggressive
Hmm.
tracing of contacts, aggressively containing those people who are uh, potential virus carriers was required. And obviously the population is very high and there is a lot of congestion. Social distancing, maintaining social distancing in Mumbai is not very easy. All those challenges are there, but despite
Yes.
that, the way we have brought in lock 1, 2 and 3, rather I am thinking of going one step forward and introducing lock 4. Lock 4 means within the home, if there are 5 persons, we should be
Right.
able to keep them separate. So I am working on
Okay.
this as to how do we bring in that particular protocol, that because I can't breach the privacy of people's homes, but we were
Right.
thinking how is it possible for us with the cooperation of people to bring in lock 4 as well. So what I am trying to say, ma'am, a strategy we have devised, there is nothing novel about this. What we have
Right.
done is we acted in a very, very proactive manner, and we
Right.
implemented all these solutions ruthlessly. So
Right.
in Maharashtra, I have no doubt that Maharashtra police, Maharashtra administration is equally and more competent than us, and they are
Absolutely.
working hard, and they are really concerned, and they are taking all efforts to contain the virus. And
Right.
whatever I have suggested, if I am confident that they must be taking all these steps. If they are not, they should go by our model, and they can definitely come out with much better things than what I have told you. And I
Right.
have no doubt if they implement this kind of a system, a comprehensive system, we should be able to contain the virus. But ma'am, we have to understand that solution is not containment. The
Right.
solution is we need to get a vaccine. So
Right.
uh, let us contain and save lives and delay, gain as much time as possible so that we will be able to develop a vaccine. And once a vaccine comes, everything is sorted out.
You have a close relationship with Nagpur. What is that about?
Close relationship with Nagpur means I am a Nagpurkar and I have
Right.
studied in VRC,
Right,
and
sir.
I did my
VNIT now.
yeah, VNIT now. So I did my graduation in mechanical engineering. Then I went to
Right, sir.
IIT Delhi. I did my post graduation, and obviously later on I kept on pursuing my interests. So cybercrime is my expertise. I have done my
Right.
PhD in
So,
information security.
so graduating in mechanical engineering, how has that education in VNIT, because Nagpur has a lot of students who pursue engineering. So how has that helped you in education to be in the front line during this pandemic, which is so new for everybody that you often get confused as to how to act during certain situations.
Engineering provides you with one skill, which is that logical thinking. So it helps you.
Right.
So that is one, and you have a problem-solving approach when you are an engineer. So problems
Right.
are in police department or in administration. You get variety of problems every single day.
Right.
So if you have a clarity of thought and a
Hmm.
problem-solving approach, it helps you a lot. And what I did here is basically solving a problem. Problem is to
Hmm.
contain the pandemic, and we have
Right.
contained by bringing in some local solution. So it helps.
Right.
It logical thinking helps. I can't say that engineers are better administrator. I won't be able to say that. But yes, if you have logical thinking and clarity of thinking, you will be able
Hmm.
to solve problems in a better manner.
Right. So, lastly, what message or what advice would you like to give to the citizens across the nation so that we all together can come over this the virus really soon?
Stay home, stay safe.
So I am sure after all the implementations and after everything you've spoken about Kerala, I feel that people should take a lesson from that, and definitely after this, they should stay home and stay safe. They should see how well Kasaragod has done. After the implementation and after the hard work you've put in the district, on behalf of my team, sir, I applaud you for all the efforts you've taken for citizens like us, for the betterment for us, and for the comfort of us, and putting yourself at risk. You're making sure that we are comfortable at our houses. So I really thank you for that.
Subscribe to Nation Next YouTube channel and press the bell icon to get regular updates from Nation Next. Also like Nation Next Facebook page and follow us on Instagram and Twitter.